The National Academy on an Aging Society reports that the most common chronic conditions for those 65 and older are hearing impairments, arthritis, heart disease, hypertension, and cataracts. Paige Holt, Doctor of Audiology at Lake ENT, explains that while you cannot reverse hearing loss, you can treat it.
There are basically three types of hearing loss. There's what we call nerve loss, and the fancy term for that is sensory neural hearing loss. That is basically degeneration of the hearing nerve. The most common causes of degeneration of the hearing nerve are aging, exposure to loud noise, and family history can contribute. And that is permanent. We usually see that in your mid-50s or 60s, and we can correct that by way of hearing aids. A very important part of recommending hearing aids is learning about the lifestyle of the individual. If you are someone who's at home, then you probably don't need one of the more moisture-resistant type of hearing aids. But if you're a very active individual who's out dancing, playing golf, more actively involved in the environment, perspiring, then we definitely need to make a choice that we're going to select a hearing aid that can resist moisture and the problems that we could have more so than others. There are certain types of hearing aids that we would want to avoid if the person has a lot of problems with earwax. We don't want any parts sitting next to the earwax that would be damaged. So we need to learn about the patient, their lifestyle, their body, their ears, to help us determine what is the best recommendation for them. The hearing loss is not the only thing that determines what hearing aid we will use. There are many different hearing aids to select from. We are an independent hearing aid dispenser, which means that we can carry many different brands of hearing aids. We're not going to be stuck with one particular brand. There are different levels of technology. So we have entry-level technology, mid-level, up to high-end level technology. So there are 4 or 5 different tiers of hearing aid technology. And to say that you have to spend $5,000 or $6,000 on a set of hearing aids would not be accurate, because we do find that most of the time we can help people with considerably less cost.
For more information on hearing aids and the audiology services available at Lake ENT, please click on the Age and Hearing Loss story link on our homepage at yourhometownhealth.com.